If you are a man and you have too much sex, everyday sex, you are going to get stroke. How true is that?
No, I don't. Then our parents, our forefathers, all of them would have gotten stroke because you see, at that time their source of entertainment was sex.
26 years dying within 24 hours.
By anatomy, it's located between the penis and the urinary bladder.
So far as a hospital we are concerned, and as a country, all the suspected Ebola cases were proven to be negative. So why would people link cholera to Ebola?
Antenatal care, we talk to them to be pulling the nipple so that by the time of delivery, the baby will be able to suck and then get the breast milk.
How much am I supposed to pay if I want to call the ambulance to take my wife to the hospital?
And I'm saying you don't need to pay. The cost you need to do is to pick your fingers and dial.
Out of the 171, we have 5 deaths.
Yes, men too stand a risk of having breast cancer.
If I'm sick, I cannot be here asking you questions regarding cancer. Hi there, welcome to another edition of Traditional Port Family Health Show. This is a family health show where we go to the root, we go to the source, we go to the expert to talk to them regarding sensitive health issues. So today we are located within the premises of Korle Bu Teaching Hospital, to be precise, at the simulation room where they do carry treatment on cancer. We are here to talk to the experts regarding cancer. I have with me Andrew Donko, who is a clinical lead in cancer. I'll be talking to him and a host of others in a jiffy. But before I will do so, let me go for a short commercial break. We'll be right back.
Cancer is no respecter of human being, male or female, young or old, rich or poor. Globally, approximately 70 million people will be living with cancer by the year 2050. An estimate of 655 people will die of cancer every year. In Ghana, 7 out of 10 newly diagnosed cancer patients die within a year.
A healthy lifestyle and early detection can save your life. There are several ways cancer can be detected early. For example, through medical screening, as well as clinical diagnostic procedures such as mammography for breast cancer, pap smear for cervical cancer, and PSA or digital rectal examination.
Good news. At cancer awareness,
there is hope.
Welcome back. Just like I said, I have Mr. Andrew Donko, who is a clinical lead in cancer. Hello.
Hello.
Welcome to Traditional Port Family Health Show.
Thank you.
And I also have beautiful lady in the person of
Pearl Lawson.
Come again?
Pearl Lawson.
Yeah, Pearl. And we also have
Michael Osei, also a radiotherapist.
Okay, we also have Michael Osei, a radiotherapist. But before then, let's go to Mr. Andrew Donko. Let's educate the general public. If we talk of cancer, what is cancer?
Okay, cancer basically is abnormal growth of cells. And cells are the basic unit of any living organism. When you combine cells, you get tissues. You combine tissues, then you get organs. You combine organs, you get organ system. Then you have a whole human being. So we have cells that make up our eye, our breast, our prostate, our legs. So cancer can occur at any part of your body. You can have cancer of the head. You can have cancer of the eye, you can have cancer of the breast, you can have prostate cancer. 100 different types of cancers. So breast cancer, which is very common among women. We have prostate cancer, common among men. Then we have retinoblastoma, that's cancer of the eye, common in children. Then we have brain tumors. So now I've mentioned tumor, like we have 2 types of tumors. We have the benign tumor, then we have the malignant tumor. The benign tumor, they are not cancerous. When they occur in your breast, it can be removed. It cannot cause any harm to you because it does not spread. But when you have the malignant tumor, they are the cancerous. They can spread from one location to the other. So when you have malignant tumor of the breast, it can spread from the breast to your spinal cord to your brain if nothing is done about it. So early treatment, we always say, is the key. So cancer, mostly we associate cancer to death. But when you seek early treatment, you can live your normal life. That's something little about cancer.
A healthy lifestyle and early detection can save your life. There are several ways cancer can be detected early. For example, through medical screening, as well as clinical diagnostic procedures such as mammography for breast cancer, pap smear for cervical cancer, and PSA or digital rectal examination.
Good news. At cancer awareness, there is hope.
Welcome back. If we talk of cancer, we now know cancer. What are the causes of cancer?
Okay, thank you. At the moment, research has been carried out. Several research, we have evidence-based, but we can't specifically say that this is the exact cause of cancer. But we have what we call the risk factors of cancers. These are the things that an individual, when you start doing, your chance of having cancer increases. Yeah. So one, aging. You can't reverse aging. As you grow, your chance of getting cancer is very high. Like cervical cancer, breast cancer, prostate cancer, related to aging. And gender, as a male, your chance of having prostate cancer is high. You don't expect a lady to have prostate cancer because a lady is not having a prostate. Yes. And breast cancer too, as a lady, your chance of having is very high. But men too, you stand a risk of having breast cancer. Men? Yes.
Like seriously?
Yes, men too stand a risk of having breast cancer. Last year we treated men with breast cancer in this department, so it's not something new, but the incidence rate is quite low. That's why you don't hear we talk about men having breast cancer.
This would be risky because how can I find out that I'm having breast cancer?
We have like monthly examination that men too we have to carry out, just like our ladies carrying it out. But mostly the intention has been on the ladies, because they have the higher chance of having it. Then when you start taking what we call the hormonal drugs, there are some drugs when you are sick and you are being given, your chance of having certain cancers are also high. Then our lifestyle, having multiple sex partners, yes, your chance of having cervical cancer is also high.
Seriously?
Yes, because there is a virus called the HPV, human papilloma virus, which has been related to cervical cancer. So multiple sex partner, your chance of having that virus increases. Yeah. Then our diet, the kind of food that we eat, taking in fatty food and being like less active, not exercising. So when you combine all these things and you think that you fall within that range, seek early advice as early as possible. And also we have the gender factors. The gender as in maybe your mom, your aunt, your sister was diagnosed of breast cancer. Your chance of also having breast cancer is... That is heredity? Yes. So there are clinics that goes into like genetic clinic. So if you know that your mom, your dad, your auntie had breast cancer, outside they have the genetic clinic, then they start following up on you as early as possible.
Someone also said canned products, like canned food. How does it also?
Because of the chemical factors, that's why we also have the expiry date of any product. So when you are eating anything, just check the expiry date. I can't concretely say that when you are taking in canned products, your chance of having cancer is high. But when the product has expired and you take in, the chemical factors may cause other harm to you, not even cancer.
What about pollution and industrial waste?
Yes. Nasopharyngeal cancer, your chance of having it is very, very high. Sometimes when you are passing through Accra, the burning things around, taking in the smoke, it's not good for our health. Nasopharyngeal cancer is high, and brain tumors. So we advise people to reduce the pollution in the environment. Yeah.
Wow, we are all at risk because if you are located within an industrial area where all the time there are pollutions, like the pollution from our vehicles and other things, we all stand a chance of having cancer. On the same causes, someone has to take a responsibility of sending certain informations to the general public regarding some of these things. Whose responsibility is it to make sure that some of these factors you've listed is taken care of? But before you answer this question, let me take a short message from my sponsors. We'll be right back.
There are several ways cancer can be detected early. For example, through medical screening, as well as clinical diagnostic procedures such as mammography for breast cancer, pap smear for cervical cancer, and PSA or digital rectal examination.
Good news. At cancer awareness, there is hope.
Welcome back. I'm talking to a clinical lead in cancer regarding cancer, and he's spoken a lot. Particularly, what I'm more concerned is multiple sex partners. So if you are watching us in your various homes and you are then type who, because you be fanboy or fangirl, you think you can flirt around, it's not good. Cancer is dangerous. Secondly, environmental factors, laboratory prepared chemical content, the food we eat, and pollution, contributing factors to cancer. I was asking him whose responsibility is it to ensure that such informations are out to the general public so that we will at least try and reduce the rate at getting cancer. And I've just been referred to
Mr. Michael Osei.
Mr. Michael Osei. Yeah. Okay, Mike, whose responsibility is it to ensure that informations of such nature reaches to the general public? Because in as much as we are concerned, you know, in Accra we have television and other things, but if you go to the outermost part of the country who don't have access to radio, have access to television, how do you send these messages across to them?
Well, I can't speak for other people, but as radiotherapists, we also have our social responsibilities. Now, we the therapists here, we have an organization called At Cancer Awareness. We don't limit our work in the radiotherapy center. We go outside the center, within Accra, outside Accra, in the villages. We talk to people about cancer, we screen them, and then we give them the necessary advice. Now, the only problem we are having now is how to people to sponsor us to be able to go out there and reach out to this kind of people, because now this organization that I'm talking of, we don't have any sponsor. We do this from our own pockets, and thanks to Mr. Andrew Donko once again, he started everything, and then we also came in to support. We've also had some churches who also help us in terms of monetary and hosting us when we move outside Accra. So as therapists, as I said, we also go out and talk to people. We want to do this very often, but we don't have the necessary support that will make us go out often.
Okay, Madam, what about the media? Have you made any approach or attempt to invite the media on board?
Okay. Actually, we've had some media houses inviting us to give a talk on cancer, and Mr. Andrew Donko, who is the president of the Ghana At Cancer Awareness Ghana, he's been on several talk shows. And when we go for our outreaches, we involve the media. We try to get a radio station or a TV station in the region or the vicinity where we are having our medical screening, and they host us and we talk about cancer. We create awareness, and then we talk about the treatments and everything, so that we involve them in our medical outreach.
Okay, I'll be coming back to you soon, but then before I do so, let me talk to Mr. Andrew again. Mr. Andrew, so now I have cancer. What do I see to alert me that I have cancer?
Yeah, just like any other disease, there are signs and symptoms to look out for. In cancer, we've come out with an acronym called the CAUTION, C-A-U-T-I-O-N, CAUTION. C stands for changes or any abnormal change in your body. So maybe when you see that your eyesight is fading you, maybe you felt like a lump in your breast is changing abnormally, one is becoming bigger than the other, maybe you've been seeing blood or discharge. Like, all these things are changes that is taking place in your body. So when you see any abnormal change, just consult your medical doctor. Then the A is like an abnormal growth. Maybe you've seen an abnormal growth in your lump, your breast, or an abnormal growth around your penile region, an abnormal growth in your eye. Maybe your nose is becoming bigger, an abnormal growth, your thigh is becoming bigger, an abnormal growth, so just see a medical doctor. Then U is what we call the unusual bleeding. Maybe as a lady, anytime you have sex with your partner, you see blood. If you're not having your menses, it's not normal to be seeing blood after sex. So all these things are abnormal issues. Then T is the tumor or tickling, or maybe a tumor in your breast, a tumor that in your brain. That one may not see it, but medical examination you may determine it. So when you see all these things, just consult your medical doctor. Then the I is an indigestion. Maybe anytime you eat, you find difficult to digest the food. Immediately you take in food, then you vomit, which is not good. Food is supposed to digest and take in the nutrient, but immediately you take in the food, then it just comes out. It may be like a growth in your intestine, a growth in your stomach. That's why you are having these challenges. Then the O is obvious change in warts. Maybe you have warts on your skin, genital warts, then you start seeing that it's changing abnormally, it's increasing in size. It's a condition of cancer. I'm not saying it's cancer. See your doctor for diagnosis. Then N is the nagging cough. You've been coughing for a week or two. Please see a medical doctor. It could be lung cancer. It could be like any respiratory disease. Just see a medical doctor for diagnosis. So these are the common signs and symptoms to look out for. They are specific signs for specific cancers, but this is the general signs for cancers in general.
Okay, he's spoken a lot, but my problem is, we see all of these things, but in Ghana, or let's say in Africa, like, early treatment is now a problem for us. I would like you to talk about treatment, but before we do so, let me go for a short commercial break. If you're a man and you have too much sex, everyday sex, you are going to get stroke. How true is that?
No, I don't. Then our parents, our forefathers, all of them would have gotten stroke, because you see, at that time, their source of entertainment was sex.
26 years dying within 24 hours.
By anatomy, it's located between the penis and the urinary bladder.
So far as a hospital we are concerned, and as a country, all the suspected Ebola cases were proven to be negative. So why would people link cholera to Ebola?
Antenatal care, we talk to them to be pulling the nipple, so that by the time of delivery, the baby will be able to suck and then get the breast milk.
How much am I supposed to pay if I want to call the ambulance to take my wife to the hospital?
And I'm saying you don't need to pay. The cost you need to do is to pick your fingers and dial.
Out of the 171, we have 5 deaths.
Yes, men too stand a risk of having breast cancer.
If I'm sick, I cannot be here asking you questions regarding cancer. Welcome back. Just like I said, today I have Mr. Andrew Donkor, who is educating us on cancer. He's spoken a lot. Now, we would like to find out from him treatment. Now, if I have cancer, what are some of the treatments you need to carry out?
Okay, for cancer, first line of option is surgery. Okay. Yeah, like breast, you may do mastectomy, we have lumpectomy, then advanced surgeries. And also we have chemotherapy, that's taking of drugs, because the cancer cells, they can spread through the bloodstream, they can spread through the lymph nodes. So you have to take in drugs so that you kill all the cells that are in your blood. Then we also have radiotherapy, whereby you use special machines that produces special radiation to treat the cancer cells after surgery or before surgery. So these are the basic or the primary treatment for cancer. But mostly because of financial reasons, because of like social control and influence factors, most of our patients comes in late. They delay. Yes, they delay. And because of spiritual factors, people think cancer is a spiritual disease. So if I have cancer, I have to seek a spiritual dimension, because something that we don't have the exact cause. Why should I go and see a medical doctor? I have to seek spiritual dimension. So these are some of the factors that delays our patients. They turn out to spend much of their time at the herbal centers, at the spiritual centers, seeking alternative treatments. And current evidence have shown that people who delay in their treatment or seeking medical help tend to have an advanced stages of cancer, maybe stage 3 or stage 4. Before they get to this department, their cancer would have been out of control. You can't do anything but only palliative care or supportive care that you can provide. So we always advise seek medical attention early when you see any abnormal changes in your health.
Okay, now what are some of the preventive measures? Now I've heard all what you've said, but now what do I do so that I'll even prevent myself from getting it in the first place?
Okay, first, stick to one partner and be faithful to your partner. Yeah, that's the first option I will tell you. Stick to your partner, be faithful to your partner, because the HPV virus is very common. It's very, very easy to get.
So this one is not even really about like sexual transmitted disease alone,
yes,
but you can still get cancer.
Yes. So the HPV, which is related to cervical cancer, is very common to get. So please stick to a partner. Multiple sex partners, I don't advise. Then also, when you see any like abnormal changes in your system, go and see your medical doctor. And let's exercise a lot, at least 3 times a week, about 30 minutes each day. Exercise so that you burn the excess fat in your system. At least let's exercise. And also every woman, at least a month, you should carry out self-breast examination to identify if you have any abnormality in your breast. Maybe your nipple is retracting, or maybe you're having discharge. Carry out monthly examination. Then let's avoid taking in fatty foods, and let's take in a lot of fruits and vegetables. Yeah, let's take in a lot of fruits and vegetables. When you do all these things, it can reduce your risk of having any cancer. There are some of the factors you can't do anything about it, like gender and age. They are the non-modifiable factors, so that one you can't do anything about. But inactivity, like multiple sex partners, they are modifiable factors that you can do something about. So let's take in a lot of fruit and exercise.
That means we are contributing factors to us living long or dying early.
A healthy lifestyle and early detection can save your life. There are several ways cancer can be detected early. For example, through medical screening, as well as clinical diagnostic procedures such as mammography for breast cancer, pap smear for cervical cancer, and PSA or digital rectal examination.
Good news. At cancer awareness, there is hope.
Welcome back. Mr. Michael Osei and Pearl Lawson. Are you working hand in hand with the Ministry of Communication? Because those days we see vans going through our villages and announcing or sending out information regarding some of these things, like with PA systems. Has any attempt like that been done?
Well, not to the Information Ministry per se, but when we started this organization, we wrote a letter to the Ministry of Health. We didn't get any positive feedback yet. Now, I want to use this platform or this medium to just extend to the people out there, the corporates, the authorities. The people need to be informed. As we said, if you come in early diagnosis will yield to a very good result. When you come in early with cancer, you'll be able to have a treatment. You'll be cured, I can say for that. But the people need to be informed to know all these things. So I want to plead with all the people out there, even the media houses, invite resource people to talk to people about cancer. Not only about herbal and spiritual aspects, but also the physical. And I also would like to use this medium just to announce that we'll be having, at Cancer Awareness, we'll be having an outreach and a free screening at Domi Pillar 2 on 6th December this year, 2014. That's the day after the Farmers' Day at Otobia Hospital at Domi Pillar 2. Yeah, we'll be having education, and then we'll do free screening for everybody, including breast screening. So everybody is invited.
Okay, Madam Pearl. Yes. Now we have companies investing in beauty pageants and other programs. This program you are carrying out is equally sensitive and equally important. I want you to send messages to those corporate bodies, and including the government.
Okay. As my colleague said, for the government, we tried getting through the Ministry of Health, but we've still not got any reply yet. And when it comes to the companies, we've contacted some companies. Some have helped us in the past, but currently we've sent proposals and we are not getting any reply. So it's like we are at our wits' end. We don't know what to do right now. So we are trying to, it's our own money we are using for the outreaches. And so the message I have for the companies out there, please, our lives are very important. When we are healthy, that's when we can work hard, and then we can all be happy and live together in oneness. If we are not healthy, if we are having all these health issues, which could later on lead to cancer, how can we live healthy lives? So what I can say right now is, please, we are seeking for sponsorship, and if you get on board, we'll be able to help people detect these symptoms earlier, and then we can save more lives, because early detection saves life. Thank you.
Well, me too, if I'm sick, I cannot be here asking you questions regarding cancer. If our viewers are sick, they cannot watch us. I would also like to use this medium to invite our churches, our mosques, corporate Ghana, individuals. You know, some people have money to travel outside for treatment, but some people who are in Ghana here, even their month's salary is just minimum. So if you have any small money, is there any account number where people can send donations and other things?
For now, I can't have the account number of her, but we have an account. So in case you want to contact us, you can just reach us 0546 403 133. So if you want to contact us for like an educative program, or you want to sponsor us, you can just reach us 0546 403 133. Thank you.
Yeah, we can all get cancer. Let's all rise up and fight against cancer. I've been your host, Nana Osu Emmanuel. Keep watching Afrostar TV. Bye.
The name of the Lord is a mighty tower. The righteous shall run into it. For any day I say, and until I'm about him, my